Assalamualaikum students. Today we will discuss marker of the iron deficiency anemia and chronic risk assessment for diabetes or oxidative stress and for cardiovascular diseases. Markers of the iron deficiency anemia. These are the markers of the iron deficiency anemia. Some of the markers we have already discussed in our previous lecture, and remaining of the markers we will discuss in our next lecture inshallah. Hematocrit or the packed cell volume and hemoglobin, the ratio of the volume of the red blood cell to the total volume of the blood. We already discussed this topic, and ACT is the measure of the percentage of RBC in blood volume is or AC percentage is 3 times to HB concentration. The if high WBC count, hydration status due to hydration, and WBC count, ACT is affected. If the person living in high altitude or in northern area, its value is high or increase in value, or if the for normal or in normal conditions, or if the person is older than 50, then its value is decreases. And it is in case of the anemia or to check the iron status, the ACT is a good indicator. Serum ferritin is a storage protein and found in liver, spleen, bone marrow. As the iron supplies increases, the intracellular level of the ferritin is increases, and small amount of the ferritin leak into the circulation. And primary ACD is a primary condition in which ferritin fail to correlate with iron stores, or ACD is a common form of the anemia of the chronic and inflammatory diseases. ACD, anemia of the chronic and inflammatory diseases. In hospitalized patient or cancer or infection, and during inflammation, red cell production decreases, and inadequate mobilization of the iron from its storage sites. In those with arthritis or depletion of the stored iron well, and reduce the absorption of the iron from the gut. In healthy person, the measurement of the ferritin uh, that has leaked into serum is excellent indicator of the size of the body iron storage pool. We already discussed the iron supply increases, the intracellular level of the ferritin is increases, and the small amount of the ferritin leaked into the circulation, and this leaked ferritin is an excellent indicator of the size of the body iron storage pool. Serum iron. Serum iron test measure how much iron in a serum, and it is a liquid that left over blood when red blood cell and clotting factors are the removed. When these clotting factors and red blood cell are the removed, then we call serum iron. And serum iron test to check the abnormal low and high blood iron levels, and having too, if too low or too much iron, that cause the serious health problems. Homocysteine test is used to measure the amount of homocysteine in blood, and it is a amino acid that body used to make protein, and B12, B6 and folic acid are normally break down homocysteine, and in normal person or in healthy person a few or a very little homocysteine left in the bloodstream. But if the deficiency of B6 or B12 or folic acid, the high level of the homocysteine. So, uh, high level of the homocysteine is one of the indicator of the deficiencies of these vitamins. Test for the macrocytic anemia. Macrocytic anemia present or occur if the size of the red blood cell is large and it will be greater than 100 FL, and when a cell grow too large, then it carries the less hemoglobin, and blood is not as a oxygen rich, and low blood oxygen can cause symptoms or health problems. Macrocytic anemia is not a single disease but a symptoms of the several medical conditions, nutritional problems. In macrocytic anemia, the red blood cell produce DNA too slowly to divide. Folate and B12 assessment. In folate assessment, the first test or first marker we consider the serum folate, mm, and others are total plasma homocysteine and red cell folate. The total plasma homocysteine is not is a sensitive marker and compromised in patient with deficiencies of a vitamin B12 or B6, or in case of the inborn error. So it is correlate with serum folate and red cell folate. And other is the concentration of the folate in red cell is a good indicator of the folate status, and it is not influenced by a transit change in dietary intake, and not a sensitive marker like total plasma homocysteine. And serum red cell folate concentration are most frequently used indicate or marker to assess the folate status. And other is a vitamin B12 assessment. It is serum B12 indicator is used, and it is compromised by intrinsic factors and antibodies. Antibodies suggest the main cause of the macrocytic anemia. Chronic disease risk assessment. American College of Cardiology and Heart Association release new practices when we deal with the patient who are at risk or danger risk, the main four groups are here. If the patient is with cardiovascular disease or high level of the LDL or high level of the LDL according to their age or diabetic, these are at high risk for cardiovascular diseases or maybe chances of the cardiovascular diseases in 10 years. Or the in lipid assessment, 12-hour fasting, the first protocol when we do the lipid assessment, the 12-hour fasting in when we do blood sampling, and fasting is necessary. Or in chronic diseases risk assessment, other is the hemoglobin A1C and diabetes. The H1AC is the most accurate test when we diagnose the diabetes or check the uh, record or level of the glucose in last 3 months. So HA1C is the most accurate test in case of the diabetes because the red blood cell life almost 120 days. After 120 days is breakdown, so if HbA1c is a good indicator. The level of the HbA1c in normal person is 4 to 5.6, and in case of the pre-diabetes, the level of the HbA1c is 5.7 to 6.4, and in case of diabetes, the level of the HbA1c is 6 greater than 6.4. So if the person is a diabetes, and to reduce the risk of the cardiovascular diseases and other diseases, the level of the HbA1c is should be below or around 7. So if the person is diabetes, the level of the HbA1c should be around or below 6.4 to 7. If the level is greater than this, so increases the chances of the cardiovascular diseases is more. Markers of the oxidative stress and inflammation. So firstly we will discuss free radicals. Basically free radicals are the unstable molecules. They can damage the cells in body, and it is a result of the normal metabolic process or when body uses the oxygen, it produces the or byproduct is the free radical. And in normal conditions or it is not affect the body, or when free radicals are exposed to the environment like the radiations, drugs, pesticides, cigarette, they affect the body. When a person is taking balanced diet or eating all food groups required for their body needs, the free radical does not affect. But if the person taking unhealthy diet or consuming those food items that promote the free radical, or the lifestyle in which smoking, radiation, so these in these conditions the free radical function is opposite or then affect the body. And then excessive free radical exposure is associated with increased the risk of the chronic diseases, heart diseases, cancer. So the main step in avoiding the free radical exposure to taking the antioxidant and vitamin E. So in markers or when we check the status of the oxidative stress, the concentration of these compounds are correlate with their balance between their intake and production, and they are used during inhibition of the free radical compound produced by oxidative stress. So the functions of all the protective compound is to inhibit the production of free radical or reduce the oxidative stress.